If you're listening to me now, it's because you or a loved one has AMD, age-related macular degeneration. For those who are 50 years or older, age-related macular degeneration is the leading cause of vision loss. Almost 14 million Americans have AMD, and that number is growing daily. As the name implies, AMD affects the macula. The macula is the center of the retina, where light is focused. It's where we get our sharp, clear vision. There are two types of AMD. Dry is the earliest and most common type. Dry AMD is often characterized by waste deposits under the retina called drusen. Most people with dry AMD see normally outside in bright daylight, but they have trouble seeing indoors, like reading, or at night while driving. The worst cases of dry AMD develop wearing out of the macula. This is called geographic atrophy. Geographic atrophy increases rapidly over time, and as it does, vision worsens with loss of central vision. This makes reading, seeing faces, and driving impossible. About 10% of people with dry AMD develop the second type of AMD. This is called wet AMD. Wet AMD is the main reason people lose their vision from AMD. Wet AMD happens when scar tissue develops under the macula, destroying the central vision. Loss of vision from wet AMD can happen suddenly. When wet AMD develops, vision may worsen permanently. The main treatment for wet AMD are drugs injected into the eye. These drugs work well, but they're very expensive and need to be given every 4 to 6 weeks for the rest of your life. This is hard on patients and their families. There are also risks from injections. These include infection and glaucoma, which can result in blindness. The best way to keep good vision and avoid eye injections is to prevent wet AMD. Until now, the only treatment to prevent vision loss from AMD has been antioxidant vitamins, a healthy diet, and a healthy lifestyle. Unfortunately, these measures are not very effective. The Age-Related Eye Disease Study, or AREDS, found that certain vitamins reduce the risk of vision loss from wet AMD by 4% a year. That's better than nothing. But until now, AREDS vitamins have been the best medicine has had to offer for the millions of people at risk for vision loss from AMD. Now there's something new, something much better than AREDS vitamins alone. It's vision protection therapy. Vision protection is the first and only highly effective, evidence-based treatment for all types and all stages of AMD. Vision protection therapy is the only highly effective treatment that can protect your vision year after year after year to keep you reading, having new adventures, and enjoying life.